Jai Hind. In continuation with the educational clinical videos of PERIO Subharti, today's short clinical video would be a comparison of conventional scalpel use for incision excision versus that of electrosurgery on animal model. So always and always I emphasize that we have to remain a dental surgeon throughout our life, not just a plain dentist. That is other than painless anesthesia. IRS, incision, reflection and suturing has to be strong. So when it comes to incision, basically, we have conventional versus a thermal modality like electrosurgery. So before starting with the demonstration, the first thing which I would like to emphasize here upon is that I am using the word electrosurgery, not electrocautery. So please understand there is a difference between these two terminologies. Electrocautery basically means that we are using direct current and that current is actually not flowing through the patient's body. So what that means is more heat buildup would be there, more collateral tissue damage would be there basically when we are performing any procedure by electrocautery alone. Electrosurgery, on the other hand, uses alternating current. Here, because of a conduction plate, the patient is part of the circuit. So, the amount of heat required for achieving the desired effect, let's say cutting of tissues, etc., is much lesser. Hence, basically, the collateral tissue damage is lesser. Okay. Now, with regard to scalpel, that is BP handle also, there are two types of BP handles. One is number 3 BP handle, that is surgical BP handle, and one is number 4, that is prosthetic BP handle. So in number 3, that is surgical BP handle, we attach small surgical blades 11, 12 and 15. So these are the blades which we will be using in the oral cavity. On the other hand, if we talk about number 4 BP handle, this basically attaches blades which are much larger, blades number 20 to 24, the ones which are used in prosthetics for trimming of border molding, etc. So the first thing that we have to do is identify our BP handle. Now in number 3 also, from a surgery point of view, we might be using a plain flat BP handle. We might end up using a round BP handle. I personally prefer a round BP handle because it is easy to manipulate. And finally, in round also, we have something known as adjustable BP handle according to few areas which we cannot access directly. Maybe if I am placing an implant in the 6th area and I have to raise a flap, so distal to 5, I'll find it more convenient to use an angulated BP handle. So with regard to the demonstration, an animal model otherwise is preferable. So why is an animal model preferable? That is because you get to know the feel of the tissues in the case of an animal model. So let us start with the demonstration on an animal model with regard to a BP handle. So in this round BP handle, I am attaching a 15 number blade. Now once I have attached, the basics of learning a good incision is stab wound. I have to go till the base and then I have to move it like this. So again I will demonstrate. I have to achieve the desired depth with my first incision and then I have to move it forward, and this is how an incision is achieved. So this is fast, this is quite economical, but the only issue would be oozing will occur in a patient's mouth whenever this incision is given. On the other hand, if I have to give an excision, do an excision, I'll be removing it like this. So here the oozing will be even more, because in the case of an incision, I'll be able to approximate using sutures, but in the case of excision, instead of healing by primary intention, the healing will be by secondary intention. So that brings us to the next question, that where exactly would these things be used? So whenever I am telling incision with blade, this is the conventionally used method. This would be used wherever I need access to bone. I have to place multiple implants, I have to do bone grafting, I have to do a normal flap surgery for correction of periodontitis. I will be using a scalpel because I need access to bone. However, there is an issue. Whenever I need to do any procedure in which I need to simply shave off the tissues, that is superficial part is there. So in that, shaving off doesn't come out that easily with a blade. I can shave it off but it won't come out that smoothly. So this is where a thermal modality is more useful. So whenever we talk about a thermal modality like electrosurgery, there are basically two types of electrodes that we use in electrosurgery. One is a needle electrode, which is used for incision. One is a loop electrode, which is basically used for excision and superficial deepithelization. So let us see the incision part first. So for incision, first and foremost, a conduction plate is required, and that conduction plate is put on the tissue or the patient's back wherever we are planning to do the surgery, meaning the patient becomes a part of the circuit once we are using a conduction plate. So now I am ready to do my incision with electrosurgery. So electrosurgery incision is basically fast, some amount of smoke is produced, but ultimately it is a self-sealing incision. So what do I mean by self-sealing incision? No blood would be there. Suppose I want to do a case of aesthetic crown lengthening, that is gummy smile correction, I can easily use it like this. So can you see? On the whole, beautiful scalloping can be given with the use of electrosurgery. So electrosurgery is a beautiful modality, quite economical, which can be used for incision. At the same time, for excision also, we have a loop electrode. So excision, or rather deepithelization, is comparatively a more superficial process. So can you see? I am using this basically for removing of the epithelium. So where exactly would I be using these modalities? I'll demonstrate excision also. So in case we hold it like this, and if I were to use it for excision, that is, I have to remove some epilis, etc. I'll be removing it like this. So this would be a self-sealing area. Hemostasis would be there in this area. So this is the advantage of using electrosurgery. So this was just a short demonstration on animal model of the use of two modalities. Blade, if I need to access bone. Electrosurgery, whenever I need to do anything which is superficial, I don't need access to bone. For example, if you want to do initial preclinical training of these procedures, I would highly recommend doing it on animal model first, especially with regard to a thermal modality like electrosurgery, because cutting with electrosurgery is like cutting of butter with a hot knife. If you let it sink, it touches bone and bone necrosis might be there. So always practice first on animal model. That would be my suggestion. If you want to have a look at the various procedures, we have 3 videos already present on our YouTube channel. One is tongue tie correction with the help of electrosurgery. Second is gummy smile correction, that is aesthetic crown lengthening, a very important perio-aesthetic surgical procedure with the help of electrosurgery. And finally, we have depigmentation with the help of electrosurgery. So any such procedure where raw wound would be there, where basically healing would be by secondary intention, I would prefer anytime thermal modality over conventional scalpel. Any procedure in which ultimately I have to access bone only, I would prefer conventional modality. One final point is that many a times few marketing gimmicks are there with regard to thermal modalities, especially laser. So what they say is laser is painless, thermal modality does not require anesthesia, etc. All that is a gimmick. Please understand, a cut is a cut, be it by blade, electrosurgery or laser. Basically, anesthesia is required. Post surgery, whenever you are using a thermal modality, since the modality is cutting by heat generation, burning of the tissues, the amount of inflammation, edema, pain, etc. would be more as compared to a blade. So post-operative anti-inflammatory drugs are definitely required. We hope by this short demonstration, all of you were able to gain a little bit. Please do follow our channel for more educational videos on various perio procedures. Our next video would be, a short video would be there on various types of bone grafts. Thanks a lot for watching. Jai Hind.